it's CJ. Have you ever heard of pelvic floor physical therapy? If not, today is your lucky day, especially if you or somebody you love is struggling with any form of pelvic floor dysfunction. I'm going to let you know what it is, what it can be used to treat, and if you stick around, the things that you can do to best prepare for your first visit. Pelvic floor physical therapy is non-invasive. It is safe and very effective for the management of a number of different issues for not just women, but men as well. It is done by somebody who has been specially trained and uses exercises, breathing techniques, biofeedback, to name a few. So what can it be used to treat? Number one, if you are leaking urine or every time you sneeze, laugh, cough, or exercise, pelvic floor physical therapy can definitely help. Number two, if you are having unexplained pain in your pelvis. Number three, if you are having issues in the bedroom. For men, it can help achieve and sustain an erection. For women, it can actually help achieve orgasm. It can also help if you're struggling with pain during intercourse. Number four, if you are experiencing any kind of pelvic organ prolapse, stuff is starting to droop. It can help strengthen those muscles and avoid surgery. And number five, if you are either pregnant or have recently had a baby, it can help with the postpartum recovery period. So if you have decided that pelvic floor physical therapy is right for you and you have been referred to a therapist, here are the things I recommend you do in preparation for that visit. Number one, check with your insurance company to make sure that pelvic floor physical therapy is a covered benefit. Number two, on the day of your appointment, make sure that you're wearing comfortable, loose-fitting clothing. Number three, be prepared to answer a number of questions regarding the history of your concern. I do recommend that you keep a diary of your symptoms for up to a week prior to your visit, if at all possible. When the symptoms are occurring, what triggers them, and what makes them better. Number four, anticipate having some level of physical exam. It will depend on what you're comfortable with. Your therapist may want to do a vaginal or a rectal exam. However, if you are not comfortable with that, that will not happen. And number five, keep your appointment, even if you're on your menstrual cycle or if you're pregnant. The physical therapy can go on regardless. One thing you don't need to worry about, you don't need to worry about shaving down there. Honestly, your therapist doesn't care. So, have you ever done pelvic floor physical therapy? What was your experience like? I hope you'll let me know in the comment section below. And while you're in that comment section, I would also really appreciate it if you'd hit the like button. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.